Now I will give you an injection of local anesthesia. This will sting for a little while. Then this area of your arm should feel numb.
Inject a small amount of local anesthetic, 1% without epinephrine, just under the skin to raise a wheal. Next, advance the needle 5 centimeters in the direction where you plan to put the implant, and inject 1 milliliter of anesthetic in a subdermal tract. Check for anesthetic effect.
Do you feel any pressure?
No.
The implant that we are using today has 2 rods that will be placed under the skin through the same incision.
Using a scalpel, make a shallow 2 millimeter incision through the skin, or if using a disposable trocar, gently make a shallow puncture into the skin of no more than 2 millimeters. Make sure the plunger is inside the trocar. Then place the tip of the trocar in the incision and hold the trocar so it is horizontal to the arm. Advance the trocar subdermally, checking to see that it is pointed slightly upwards so it creates a tent with the skin. Proceed approximately 5.5 centimeters to the mark on the trocar that is closest to the handle. Do not force the trocar. If you run into resistance, try a different angle. Now remove the plunger and load the first rod into the trocar with forceps or your gloved hands. Reinsert the plunger into the trocar and push gently on the rod until you feel some resistance. Remember, do not force the plunger.
Do you feel any discomfort?
It is a strange sensation, but I don't feel any pain.
Good.
Next, hold the plunger firmly in place with one hand and pull the trocar toward you until it reaches the plunger handle. When you are sliding the trocar, pay attention that the plunger does not push on the implant. Then, withdraw the trocar and the plunger until you see that the mark near the tip of the trocar just clears the incision. Be careful that you do not completely remove the trocar from the incision. Move the tip of the trocar slightly away from the rod without withdrawing it. While holding the already inserted rod in place, redirect the trocar 15 degrees. The first rod should no longer be in the path of the trocar. Continue to hold the implanted rod in place while you advance the trocar and plunger 5.5 centimeters to the mark nearest the handle. You are creating a V shape. Remove the plunger and insert the second rod into the trocar with forceps or your gloved hands. Reinsert the plunger into the trocar and push gently on the rod until you feel some resistance. Once again, hold the plunger firmly in place with one hand and pull the trocar out until it reaches the plunger handle. Palpate the ends of each rod to make sure they are placed correctly. The rods should be 5 millimeters from the incision site to prevent exposure. When you are confident both rods are placed correctly, remove the plunger and trocar from the arm. Wipe the client's skin with antiseptic such as Savlon, and then wipe it with a methylated spirit or alcohol. Bring the edges of the incision together and apply a pressure dressing tightly.
We are finished. How are you doing?
I am glad it is over, but it was not too bad. I didn't feel much at all.
You did very well, sister. You might want to rest here for a few minutes.
Okay.
Dispose of waste material in a leak-proof container or plastic bag. Remove your gloves by turning them inside out and also discard. Wash your hands completely and dry. Finally, complete the client's record, making note of the location of the rods.
How are you feeling?
I am doing fine.
Explain that for a few days she might feel some discomfort near the incision site.
You will probably feel some soreness around the incision. There may also be some swelling and bruising. This is normal. You will not need treatment for it.
Be sure she understands how to care for the wound. She should not remove the plaster or gauze on her own.
It's very important to keep the incision site clean and dry to prevent infection. We will remove the gauze and plaster in 5 to 7 days when you return to the clinic for your follow-up appointment.
What if it does become infected?
If you see pus or bleeding, or if you feel pain at the incision site that becomes worse or does not go away, it's very important that you come back to the clinic so we can take a look at it. Also, if you cannot feel the rods anymore, you should come into the clinic right away.